Hi, I'm Dr. Luke Bucci, and welcome to HealthView. So what's HealthView, you might be asking? Well, I guess the best way to describe it is it's a series of short video visits where I'll be discussing health and nutrition issues a lot of us encounter in our daily and, let's face it, pretty hectic lives. That's my area of expertise, and since 1995, I've worked closely with Shift Nutrition to develop products and practices that people like you and I can really use to benefit our busy days and nights. So today, we'll be looking at some easy ways you can change things up a little. And I know you'll feel better if you try some of them. Okay, let's get started. Weight management, that's our topic for right now. Shift Nutrition International has a few supplements that just might help you out. But first, we all know what we should be doing to control our weight and keep our weight in a healthy range. We know we should be eating better. We know we should be exercising, so I'm not going to get into that here. I really hate the term weight loss. That's got the wrong connotation now because there's good weight loss and bad weight loss. If you don't get enough calories, you're going to lose weight, but you're also going to lose muscle and bone or lean body mass. And that's what burns calories. So the more lean body mass you lose, even a 1 or 2% loss means you're burning several hundred fewer calories a day. That means you have to eat several hundred fewer calories a day to maintain your new weight. So going by the scale doesn't tell you if you have a lot of lean body mass or not. In other words, what is your fat lean body mass ratio? So that's a word of caution. Make sure that you get enough calories and enough protein to maintain your lean body mass. There is no magic pill that's going to make you melt pounds away, lose all that flab where you want to get rid of it, and make you fit into that dress in a week that you're trying to squeeze into, or that bathing suit that you're trying to squeeze into in a few days. That's just not going to happen. It took time to get that fat there. It's going to take time and effort to get it off. But there are a few things you can do to help speed up the process and keep it healthier. As I said before, you want to maintain your lean body mass. That's just as important as losing fat. In fact, there's a lot of people that actually gain a little weight or don't lose any weight, but they lose inches around the waist, which is a good thing. They lose that spare tire, they lose the chubby cheeks and the extra chin, and that's okay. That's actually healthy even if you're not losing weight, but if you're redistributing, if you're getting rid of fat. That's what we're trying to do, get rid of the extra fat. Now, what can help you do that? The right amount of caffeine with the right amount of green tea polyphenols has been shown to increase thermogenesis, or burning calories, a small amount, to the tune of a few hundred calories a day. Depending upon your body size and what you eat and how much you take, you can burn anywhere from 1 to 3 to 400 calories a day without getting into the range of caffeine that causes jitters or other unwanted side effects. And the other nice thing about green tea polyphenols is that they are very healthy. They do help your cardiovascular system, they protect your brain, they're wonderful antioxidants. They do a lot of other good things for you that makes it easier for you to stick to your weight management goals and routine. So there has to be the right ratio of caffeine to green tea polyphenols. That's key. If you have too much caffeine, too little, or not enough green tea polyphenols, or too much, it doesn't work as well. So for the best results, you need to have the right ratio, and that right ratio is in Shift Green Tea Diet. Also, green tea diet has chromium. Chromium is intimately involved in energy metabolism in the body. It works with insulin to put blood glucose or sugar into your cells. Now, if there's not enough chromium, this system gets a little out of whack and it starts storing more of that glucose than burning it. And with the chromium, it allows your body to be normal and try to burn excess calories faster than they would if chromium was deficient. So we add chromium to green tea diet to help prevent chromium from being an issue with blocking your weight management goals. One of the things I'd like to bring to your attention is Shift fruits and vegetables. Now, that's exactly what it says. It's fruits and vegetable concentrates. It takes out the water and it takes out some of the fiber so you can get all those phytonutrients that are very helpful and protective. Now, this is, again, not going to make you lose weight if you just pop a pill and sit there and wait for it to happen. What this does is it makes your weight loss management goals healthier by adding these things that you may not get enough of when you're reducing calories. These phytonutrients in fruits and vegetables, like the green tea polyphenols, help improve your metabolism a bit. And the more you can do to push yourself into burning more fat and retaining more protein, the better off you are. And I think the fruit and vegetables is a sleeper supplement in that respect. Interestingly, the more studies that are done with weight management, the more it shows that people who eat more fruits and vegetables have less body fat, they have an easier time of managing their weight. So this is one way to get there with a supplement in case your dietary practices aren't as healthy as they should be. Another nutrient, or rather nutrient combination, that does have a role to play in weight management is calcium and vitamin D. Now, there has been a significant amount of research because if calcium plays a role in weight management, then gee, all I have to do is just drink some low-fat dairy products and I can lose weight. And unfortunately, that hasn't really worked out that way, and I'll tell you why. Yes, calcium is important and is involved in weight management. If you don't get enough calcium into your body, you're not going to lose fat as well. Calcium's involved in signaling the cells to give up the fat and to go ahead and burn it. It works with the chromium-mediated insulin signals to tell your cells to start burning fat instead of storing it. So it's part of that process, part of that pathway. So if you're low, it doesn't work as well. You have a harder time losing weight. Okay, that means if I take more calcium, I'll just lose weight, right? No, that's where the research has shown it is not working with calcium. You need to make yourself adequate in calcium status, then you are more normal, you can burn calories better than when you were deficient. That doesn't mean you're going to just take calcium and start losing weight. One thing that the research is now beginning to figure out is it's not just the calcium, it's the vitamin D. Vitamin D is what is used by the body to get calcium used in the signaling processes. It also puts it in bones, as we know. Now, if you take in at least 400 IUs a day extra vitamin D, 800 IUs a day is even better, then you start getting more calcium into the body where it belongs. You can start having better chance of burning fat, redistributing the fat, unlocking those fat cells via the calcium signals. And vitamin D is crucial for that. So a lot of these studies that showed the calcium wasn't working well, they didn't give enough vitamin D. Most of us are deficient in vitamin D or have lower levels than optimal health needs. That's been the missing link in these studies, and I think a combination of calcium and vitamin D can help you reach your weight loss goals faster, reach that body fat burning threshold, and combining that with other ways to manage your weight can only lead to better and better results. So in other words, take the brakes off of your weight management goals by making sure you have enough of the key nutrients that are actually working to help you get rid of more body fat, and at the same time maintain lean muscle mass. What you need to do to reach your weight management goals is be consistent. You have to have an exercise program. You have to move. You have to control what you're eating. That means controlling what you're buying, how you're preparing it, and all those other lifestyle factors that go into controlling your eating. But once those are solved, there are some more things you can do to assist or supplement your efforts, and that's shift green tea diet to let you burn a little bit more fat. Fruits and vegetables to help maintain your lean body mass and make sure that you stay healthy during the weight management process, and vitamin D and calcium so that you will make sure that your body's doing the best job it can to unlock those fat stores. That'll give you the best chance you have of managing your weight. Then it's up to you and your lifestyle for the results you get. So give yourself the best chance you can. Well, that wraps up this segment. But hopefully it's just the beginning for you, because when you try out some of these tips, I think it'll be the start of a healthy and strong approach to living. And what's great is none of us have to do this alone. For more information about any of the products I've talked about today, simply use the product search toolbar at the top of this page because, hey, we can all use a little help. Till next time, I'm Dr. Luke with HealthView. Here's to your health.